All right, we might make a start. So welcome everyone, my name is Ash Homer. I am a researcher at the Baker Heart and Diabetes Institute in Melbourne, Australia. It's my pleasure to introduce today's session, which will be led by Dr. Lindsay Rees. So Lindsay is a Senior Research Fellow at the University of Sydney's Prevention Research Collaboration. As part of her role there, she is also the Academic Director of Sprinter, which is the Sport and Active Recreation Intervention and Epidemiology Research Centre. Alongside that, Lindsay is also the Global Lead of Advocacy for ISPAH and is an executive member of ASPA. So without further ado, I'll let Lindsay hand over. Just before we do get started, if you have a question at any time, please feel free to use the Q&A function. We'll be keeping an eye on that throughout the session, and Lindsay will also provide you with some natural opportunities to ask questions during the session. So I'll hand over to you, Lindsay.
Thank you very much, Ash, and good morning, everyone. I can still see there's a few people popping in, so I guess we'll have a slower start. I'm sure many of you have also had, if like me, you're crazy sports fans, probably a very hectic weekend, and also heart goes out to all the fellow English people after a gutting result in the football this morning. But thank you so much for everyone for joining. It's really exciting that we're delivering this morning's webinar. It is a joint webinar between the Australasian Society for Physical Activity and ISPAH, which is the International Society. So very exciting to be here on this joint session. Before I jump into what the session will cover, as we gather here this morning for this meeting, physically dispersed and virtually constructed, I would just like to take a moment to reflect the meaning of place, and in doing so reflect the various traditional lands on which we are all meeting from this morning. For me, I'd like to acknowledge the Gadigal people of the Eora Nation, the traditional custodians of this land in which I'm meeting with you all today, and pay my respects to elders both past and present. I also would like to acknowledge any elders joining this morning. So the way I've kind of structured the session's webinar is it's naturally into 3 segments. So I really would like you to submit questions as we go through, and there is a chat function, and I'll make sure I take regular breaks. And there is kind of naturally 3 sections to it, and so I'll make sure that I stop and pause and check in and see if you guys have got any questions. I'm going to start off with a bit of an intro and context to what led us to developing the 8 investments that work. Bit of background, and then I'll jump into the 8 investments. And the way I've structured that section is really focusing on the what and the why of each investment, and then the final part of the webinar is trying to think about how we actually translate that into practice and consider some advocacy tips. So that's the way I've kind of structured this morning's webinar. So I guess what I would like to do there first as well is just to hold my hands up that this is very much an overview of the 8 investments, and it is a top-level document. And the purpose of the document really is to give support and advice to you all when you're having physical activity conversations, and it's meant to be an advocacy tool and a synthesis. And the reason I kind of say this up front is that I am no means an expert in the 8 investments. I certainly have biases and more experiences to some of them more than others. But the session today will focus much more on the top level information and how we can advocate and use it rather than an in-depth analysis of each of the individual segments. Okay, so without further ado then, let's jump straight in. So if we cast our minds back to 2018, we saw the launch of the Global Action Plan for Physical Activity. And this really was a seminal moment for all of us that kind of work in physical activity. It was the global commitment by the World Health Organization to commit to having a target around tackling physical inactivity. It explicitly provided a roadmap for us all to work to, and it clearly showed how physical activity contributed to the United Nations 2030 Sustainable Development Goals. And that's really pivotal because it really sets the global context around the profile and importance of making sure that we increase our population levels of physical activity. GAPA, which you can see on the right-hand side here, this document, this is often described as having that clear roadmap, and it's structured around four strategic pillars, if you like. That's active societies, that's focusing on tackling societal norms and attitudes, active people, environments and places and spaces, and systems and governance, and those policy levers. And straight away when you start to read this document, it gives you that global landscape to say we need policies and infrastructure in place to help us really have these physical activity conversations. We then move on to 2020 and we see the release of the World Health Organization Physical Activity Guidelines. Why are these important? And I'm just going to touch on what was new in these guidelines, because this really then led to us reinventing the 8 investments. What was new here was, for a start, in the title, we see sedentary behaviour for the first time. We saw a removal as well of the having to do up to 10 minutes. All activity was the message within these new guidelines. It moved to a minimum range, so all adults being 150 to 300 minutes of activity, and adolescents equally on 60 minutes on average. But we also saw a clear articulation of certain priority groups as well. So we saw specific targets for the first time of pregnant and postpartum women, people with chronic conditions, and people living with a disability. But I guess it then shifted, why are these guidelines important? And I guess, many of us on the call today are probably academics, and a critical function of the guidelines is to provide consensus around measurement and surveillance and give us a benchmark and a roadmap for measuring progress. But they're also critical for raising awareness and health benefits to the communities and the population groups we're trying to engage. And this really gets us thinking about, okay, well, we've got this global structure where we're seeing this real recognition of the importance of physical activity. We've got clear guidelines, but we know in isolation that guidelines and documents aren't enough. If we're really going to shift these inactivity levels around the world, and we're going to match that GAPA target of reducing inactivity by 15% by 2030, then we really need to have clear support and infrastructure in place to communicate and ensure that everyone can actually have this action at the ground. So what I'd just like to highlight here is the development, and this paper by Karen Milton as part of the BGSM series on the guidelines is definitely worth a read if you haven't already, around the effectiveness of communication. But what the paper articulates is we need to be really clear on the aim of any communication we're having with people, what the messages are and how we convey them. And then critically though, this is about making sure that we have resources and policies and practices all around the world that enable us to have these conversations at multiple levels throughout the system to ensure that policymakers and stakeholders have the sufficient evidence to advocate and really strengthen that need of physical activity. So all of that context, having the GAPA released in 2020, the GAPA released in 2018, and then the guidelines in 2020, led us to then in 2021 release the updated guidance with the 8 investments that work with physical activity. And what this was meant to do is an updated version of the 2010 investments that work with physical activity. It's an update, and then you'll see there's an addition of an investment. But the purpose was to provide this clear development of a practice toolkit, if you like, for global communities at whatever level we're working in, to make sure we can advocate and have those clear conversations around how do we increase population levels of physical activity. So that really brings us right up to present day on why we need the 8 investments. So that's kind of my first little pause. It was a bit of a whirlwind in terms of the global context. I'm just going to have a little look at the chat and see if anyone's got any questions so far. I can't see too many. Thank you for sharing the link to the paper. I really would recommend everyone having a look at the BGSM. There's some really great papers in there. Okay, so I can't see any obvious questions, so I'm going to move on unless one of my fellow co-hosts flags that I'm missing anything. Okay, cool. So 8 investments then. Why do we, so I've kind of given the context on why we need them. What I'm going to do now is kind of talk through each of the investments on its own. I'm going to focus on really the why and the what of each investment. And then, as I said, that will then lead us to then think about the how. Actually, then how do we translate any of these into practice? And I'll share some exciting news for this on that one. So the first one I'm going to jump into is the whole of school programs. And when we think about why this is important, this is really predominantly focused on children that are enrolled in school, although in some countries we do focus at homeschooling as well. The benefit of having this section involved is the significant population reach. When you think about the millions of children that suspend that spend sustained time at school and education throughout the day. It also brings in a whole sector workforce, so teachers and head teachers and academics all working within the school environment provide a huge resource to make sure that we have multi-component programs in the school environment throughout the day. We also recognise that there's many evidence behind the segment around being active at school and creating an active school environment really does have positive benefits on children's development in the short and longer term. And we've also seen evidence that shows positive associations between activity and learning and academic attainment and achievement. So really, when we think about the rationale as why whole of school programs are in there, it really is an essential piece. And just to bring that to life a little bit, some examples, I guess. So when we're talking about whole of school programs, we're talking about prioritising high quality PE classes, but it's also much more than that. It's about building environments within the classroom to be active, provide structured and unstructured opportunities for play, for learning, for recreation. It's also about considering opportunities within the day, for example, active breaks, travelling to and between school. And it really is about providing maximum opportunities for people to be active throughout the whole school day, irrespective of social background or what access to PE is like. And it really is seeing this shift from purely focusing on just PE in those one single classes to thinking about the education and school environment as a whole, and having a range of programs for multidisciplines that really come together to focus on children and adolescents active learning and active play throughout the whole school environment. The next one then is active travel. This one has received significant attention in the last few years, and I guess one thing to really point out for each of the segments is that this development of a resource really it's an ISPA resource. It's led by a whole global community. There's multiple authors to each of the sections, and we have a range of resources which I'll come on to at the end. Jasper Shipperine led this particular segment, and there's podcasts and all sorts available. And I apologise, I should have said that Anna Chalkley has done the resources on the whole of school environment. So active travel then, similar to schools, it reaches a whole broad level of population. Significant numbers of people see it as a necessary activity in their everyday. We've seen, when we think back to Sustainable Development Goals, we see significant evidence of the benefit of being active on reducing fossil fuel consumption, reducing traffic congestion, promoting positive air quality. So that what's quite powerful between this segment is that whilst many of us who are physical activity advocates see the outcome as being physical activity in the movement, we also see a huge benefit on other parts of the sector, other parts of government agencies, other parts of government agendas like climate change, where we really see a positive impact of being physically active. Most of the evidence within this particular segment is focused on reducing the shorter car trips, so the car journeys that are less than 5K, and we're seeing a huge investment in cycling infrastructure, and really focusing on that benefit of the wider broad social and environmental benefits of being active. Other examples include looking at destination accessibility. So we see some programs looking at reducing car parking, increasing the cost of car parking, improving infrastructure, that's footpaths and cycling infrastructure. And for those of you that are really interested in the academic evidence on this one, there was an absolutely brilliant Lancet series published in 2016 that had some great papers exploring the links between urban design, transport and health, and what some of the outcomes there were focused on how the combination of increasing walking and cycling and public transport really did have positive impact on the city as a whole. And I've just provided a couple of examples here, and this one I've pulled out my Victorian colleagues, feats of a 20-minute neighbourhood. There's been a real shift to focusing on wherever somebody lives, they should have access to all the essentials, whether it's supermarkets, health services, groceries. Everything should be within a certain 20-minute in Victoria neighbourhood, so it's easily accessible. And we've seen other cities around the world, Paris, Belgium, Ireland, the UK, all showing big investments in this kind of infrastructure. The next one is urban design, which sometimes, it's a similar one with active travel, but it has a slightly different focus. This is much more on the environment itself, rather than facilitating the behaviours of movement. And this third segment I'm talking about here is really focusing on enabling and facilitating positive places and spaces that enable people to move. So what often we see here is a focus on building livable neighbourhoods, attractive places to live, focusing on green spaces, access to quality open space, sporting facilities. We've seen a shift in the last few years looking at open mixed land use, so looking at shops and schools and what that looks like. And I guess the big one with this one is that the majority of the world population, when we think of it at a global level, really does live in cities. So we've got and that's due to grow. So when we think about over 68% of the population living in kind of quite dense, populated areas, we need to think about how we can support and facilitate environments that promote physical activity. There's lots of studies on this one, but this one I've pulled out a few resources here because these are fairly new. These are some New South Wales government resources in Australia published towards the end of last year. And again, I quite like these because these are user-friendly, accessible toolkits that people can use off the shelf, readily available, just to help facilitate some of these conversations. The next one then is healthcare. This is one that I think probably in physical activity is traditionally one of the stronger ones. We have lots of evidence from an academic perspective on the benefits of integrating physical activity in the healthcare system. And often this one focuses on integrating physical activity within primary and secondary care. Once again, we see a real need to integrate physical activity into the healthcare systems because of the large population reach. Often it's done probably on a management or treatment basis, but obviously it really, and some of the other sectors focus on the prevention of chronic disease. But often what we're looking at here is how we integrate physical activity into routine health advice. There's significant research that shows the benefits of listening and hearing the advice from a trusted healthcare professional. Many people, after receiving a diagnosis of a chronic health condition, trust and value the support and input from their healthcare practitioner, whether that's a nurse, a GP, or a secondary care professional. So really here, what this segment is focusing on is integrating physical activity within the healthcare system, whatever that might look like within the country that we're talking about. There's significant evidence that focuses on GP referral schemes or exercise on prescription, whichever term you may use, and the evidence on those is patchy, and often we do see a shift in the evidence here focusing on reaching inactive people. So some countries that have clear articulation about having the greatest public health benefit, we've seen many countries have policies and programs in place that really target the physical inactivity end of the spectrum. Often some of the evidence has also looked at what this looks like from a healthcare professional. So you see some examples, and I'll just move on so you can see a couple of examples here. There's been some real evidence focused on upskilling and raising awareness amongst healthcare staff. So once again, within this investment, we have a whole workforce, a whole sector that's there delivering regular physical activity. And what we want to do is make sure that they are aware of the importance and benefits of physical activity and what they're and how they can promote the treatment and management of many chronic conditions through physical activity. So some of the evidence we've seen is focused on the assessment of counselling, integrating behaviour change techniques within various programs, and a couple here, for example, the Moving Medicine programme in the UK is a great example where it's really giving resources and guides to healthcare staff on how to have physical activity conversations. The example I've just put here, for some of you who may be committed park runners, so for those of you that aren't familiar, Parkrun is a community initiative, free 5K runs, walks and jogs in local parks around the world. And for example, in the UK, they actually partnered with GPs and clinical practices to signpost and refer people in the community to a community physical activity opportunity. That's just one of the examples we're seeing where we're seeing unique partnerships between physical activity and healthcare practitioners to integrate that physical activity advice within the healthcare system. Okay, so the next one is public education. It alludes to what I touched on before from the Karen Milton article about the importance of communicating and market research and social media campaigns with the communities that we're trying to reach. The term public education is used on purpose. Often this language is interchanged with social media or mass marketing campaigns. Public education is selected for this segment to really cover the top level breadth of all the different forms of communication you can use to really advocate and communicate and speak with populations across the physical activity environment that we're talking about. Once again, there's been a lot of evidence around the effective way to communicate, what that looks like, the style of messaging, and the fact it needs to be tailored to the community, clear, consistent, positive. We focused many on that, and many on the call have probably been familiar with some campaigns that I'll show on the next slide. It really is with this one, reaching the broad population, and it's about informing and educating the community on the benefits and importance of being physically active. For many, it's also about recognising the opportunities to be active. So we've seen active travel campaigns or getting off the bus a stop earlier, for example. All of those are clear marketing campaigns focused on reaching the populations to help us have communication and conversations with people about integrating physical activity into everyday life. And often that really does touch on challenging the cultural and societal norms. So it's trying to switch where we maybe jump in the car because that's the easy and it's the easier choice. It's about switching that for another active behaviour, and that's often where the public education campaigns really do target. There's some examples here I've pulled off. There's an Australian example here, which was Find Your 30, which was a Sport Australia campaign towards the end of last year. Again, Find Your 30, a lot of the evidence is around framing messages, being clear on the target audience. Find Your 30 was clearly targeting the adult population and trying to reach inactive communities to achieve their physical activity guidelines. The example here, which you can tell from the grey wet pavement, this is a UK example. This is an example of Change for Life. So again, this is where we're talking about how we can disrupt and influence someone's routine to get off the bus or stop earlier. Just shifting that. So yes, you need public transport, but can you increase the length of time walking? So that's an example of a Change for Life campaign in the UK. This one, and I'm not sure if it will play. I didn't test this earlier, so we'll see if this works. I'm just going to check in and see if can everyone hear that. I don't know if one of my co-hosts can help out with it.
Yeah, we can hear that, Lindsay. It's all good.
Okay, cool. I will restart it then, and I will, if I can. So that one is an example of the World Health Organization, Every Move Counts, and that really reinforces one of the key messages from the 2020 Physical Activity and Sedentary Behaviour Guidelines, that all activity matters. And what's brilliant from that video is you really see the breadth and diversity of different activities that people can do throughout the day, and it really does emphasise that need to just move. And I think that's a brilliant video, and that's just one of the global examples, and I know there's many others that really illustrate the evidence behind this public education campaign. So So getting on to the next investment then, and as you can tell probably as we go through, there's a significant amount of evidence and really depth in each of the segments, and just me talking to you for an hour really isn't enough. You could do an hour on each of the segments on their own right. So what I'm trying to do here is just give a snapshot of each of the 8 as we go through, recognising that we really could dive deep into each one and do an hour session on each of the individual parts. So the next one I'm going to talk through is the sport and recreation for all. And this one is, I have to hold my hands up, this is one of my biases, and this is one that I contributed to for the ISPA resource. And you can hear me on a podcast actually talking about this one. Just like with all of the investments, there is a lead for each one, and they're all available on the ISPA website, which I will give a link to at the end. This one for me is an exciting one because we've probably seen a real shift in what this means over the last few years. So the sport and recreation one is about building and enabling accessible and appropriate sporting environments and recreation environments for everyone, irrespective of background. And it really focuses on the organised and structured end of the spectrum. We recognise that for people to be active, we choose to be active in multiple ways throughout our life. We find fun and enjoyment in different activities throughout our life. Some of the segments naturally talk to different life stages. The whole of school programmes that I talked about to start with, that's very focused on children and young people. Others, active travel is very broad. Sport and recreation is also very broad. Traditionally, I guess, many children do play sport, and then we see the evidence showing a natural dropout in sport and people returning later in life. But the focus on this segment really is about providing inclusive, organised activities for everyone. And often the sports sector is a vehicle and a platform for people to access that. But also, like many other sections, like healthcare, for example, this segment really, it focuses on participants that kind of access organised sporting environments, but it also focuses on the workforce that delivers these opportunities. So often organised and structured activities are delivered through a sporting club or an association, often also led by volunteers who are community people themselves. So we really start to see multiple layers of a workforce that we can raise awareness of the benefits of physical activity, and we can also support them to then support their communities to be active through sport. With this one as well, we see multiple arms. So we see volunteering, we see a lot of the community coaching and infrastructure and referees and officials. We see a whole platform as well there to recognise the broad benefits that delivers to people. And we also have activities like major events within this section. So this is where we see major sporting events, and we see we often hear the legacy of the Olympics. This also captures mass participation events, what role they play. And I guess sometimes we focus on that from, do they increase population levels of physical activity off the back of the Olympics? We've just this weekend alone had the Euro 2025 football finals, we've had Wimbledon, all of those events, what role do they play in getting people off the sofas and out playing? But critically as well, major events like that deliver whole platform for employment and tourism and industry, and many of us probably travel to see our favourite sporting team. So when we think about this segment as a collective, we really think about the huge opportunities that we have to really instill physical activity opportunities within this particular segment. And as GAPA rightly recognises, this is often one of the most underutilised of the investments. Share. So I apologise, I don't know how I get this back to, for some reason my slides have all resized, which I don't quite know how to do, so bear with me. Let me just broaden that one. Okay, so I just want to double check my codes that everyone can still see the slides. Okay.
Yep. You can see them.
It's brilliant when your laptop freezes. So my laptop is totally frozen. So I will keep talking, but I will need a break after this one because for some reason my laptop has frozen. So what I might just do is talk on this investment and then have to take a little pause. I apologise for the technical glitches. What I've done here is just showcase on this slide, again, some examples of what we mean by sport or recreation. And as I've just alluded with, the workforce element is critical, volunteers, but we also have the elite angle. And whilst the focus on this segment is broadly looking at the role that organised sport has on population physical activity, we also must recognise that the elite athletes and the power and inspiration that they bring to many people as sporting icons and sporting role models can't be ignored. And we know that that ability to inspire and engage youth is really key. And it's almost it's remarkable. And what I love about this picture is we see the growth of women's sport. It's very timely. We've seen a huge recognition of female role models, how they engage young girls, which traditionally we see dropouts of less girls playing sport. So this is just a remarkable picture of, obviously, the inspiration of their role model cheering on from the sidelines. We also, when we think about the inspiration and the role of sport, we also consider the ability to engage different population groups. And this is a very local example. So this is from the New South Wales state sporting organisation. But what's brilliant about this one is they received some government funding, and they actually I can't play the video, I apologise, but I'll make sure I share the link. They actually developed a video and a song called How I Roll, and they got young girls living with a disability to take part and really focus on the building inspiration to be active in children with a disability. And it really is powerful stuff. So I encourage you to have a little look at that. So I'm just going to see if my screen is now unfrozen. So I think can you now see the next slide? I had a message saying I'd unfrozen, so hopefully.
Yeah. You can see workplaces.
Brilliant. Those of you know me now, I'm horrendous with technology. I know I've been doing this virtual stuff for a long time now, so I sincerely apologise, but technical glitches can't be helped. Okay, the next one is workplaces. So workplace is the additional segment to the previous 2010 investments that was published and released. And this really was included based on the breadth and depth of evidence that had been captured to really strengthen the role of workplaces and really justify its place. And that was why it was added, based on the significant evidence that had built. Once again, this has a tendency to focus on adults within the population, just based on it's the workforce environment that this segment focuses on, predominantly adults, and predominantly because many of us spend hours of our day within our working environment. And just like the other sections, this focuses on settings. So this focuses on providing opportunities throughout the day within the work environment to be active and to move. Often where we've seen a lot of the increase in evidence within this particular segment is on reducing sedentary behaviour, which recognising that the addition of sedentary behaviour in the 2021 guidelines really does emphasise the need and importance of this particular segment. Often much of the research for this one to date has focused on the environment in the working place. It's focused on the actual infrastructure and technology. So what I mean by that is we focus on stand-up desks, walking meetings, and much of the research is actually focused on what impact being inactive has had within the work environment. So we see a huge amount of research showing that physical inactivity leads to a greater risk of chronic disease, but also absenteeism and burnout. And what we know is that obviously physical activity is a beneficial role and impact on managing many of those. So facilitating and enabling physical activity within the working day really is critical for the holistic benefit. So when we focus here on workplaces, it very much is around active commuting, opportunities to increase someone's physical activity to and from work. We see regular breaks. Can you be active at a lunch break? Schedule that into the diary. Many of the evidence is focused on educational events as well. So within the team environment, there are opportunities within leadership training and management training, raise awareness of having physical activity within the self-care strategy. And you can see here just as a few prompts for me in terms of walking meetings and taking the stairs rather than the lifts. And we see stand-up desks and stand-up meetings here. And we've definitely seen a normality of these within the workplace, whereas previously we'd often see a tendency to sit. Standing up in meetings, walking around is now becoming more and more commonplace. And that's definitely something that the gap really pulls out. If you're interested within this one, the World Health Organization as well has a really practical, healthy workplace model, where they really focus on the different work-related physical and psychosocial risks, and they really give some examples of how to tackle some of the environment strategies. So if you're interested in looking at strategies in the workplace, then I would definitely signpost you to the World Health Organization toolkit. And the last but not least one then of our 8 investments is focused on community-wide programs. And this one is very much, I guess, the glue that seals many of the other segments together. This one is characterized by the multi-component, broad community physical activity approaches. Often one of these is never one in isolation. Often these are community-wide, diverse and multi-component programs. They're definitely programs that focus on a greater impact and a collection of the partnership as a whole rather than individual components. And we've seen great examples of these around the world, where it really is about bringing together all the different components, whether it's schools, healthcare, environments, aged care settings, faith settings, supermarkets, shopping malls, and the works. This one really is, there's no boundaries to this one. The characteristics of this one is that it's very much a system, very much a community multi-component program. Often systems is the latest buzzword, and a systems approach really recognises that it's moving away from the command and control model, moving away from linear, isolated programs, much more to considering the whole context, the whole community as a whole, and how each one interacts and how one can interact and affect another one. And often within these, there's no single owner or no single lead, and there's no single outcome either. So this one really does focus on the need to partner and collaborate on a wide level. And I guess one of the real characteristics of this one and the strength of the evidence is about, whenever we think about physical activity, we're often having to compete for bandwidth from other investment and other priorities. So any of us that work with government, we're always having to really advocate and strengthen how to get physical activity into those communications. What the strength of a community-wide program is that often we may be coming into the program with a bias to increasing physical activity, but the benefits may land in travel and transport and environment and urban design. So often that the outcomes and the strategies may affect other portfolios, but physical activity is a positive byproduct of that. And I've just selected here, so often within systems and whole environments and within a community, we see multi-components happening across multiple levels. Within the GAPA plan I mentioned in the 2018 global strategy, they provide a clear, articulate roadmap for a systems map. And there are some great examples of systems maps in there. I've drawn out this particular Australia example here. This was Getting Australia Active. This was published at the end of last year. And I've pulled this one out because one of the benefits behind this toolkit was around a practical guide to how to actually map a system. If you're delivering a community-wide program, we first need to take a bit of a stock take and understand, what does the system look like? Who are the key players within that system? And I know the wording is too small here, but these 4 components here are the core key pillars within the GAPA. And as you can see in the lighter blue, we start to map out the ISPAH investments. So this is a really nice way of starting to articulate what a system looks like. But critically, the big strength of this particular segment is the need for multi-component, diverse, broad programs that really do influence on a whole range of factors, from social marketing to health to aged care, the works. And it really is the glue that starts to link all the other investments together. So this kind of draws to conclude this particular section. So I kind of on a whistle-stop way, thrown a lot of information at you across each of the 8 investments. For each one, I hopefully gave a bit of an update on what the segment was and a snapshot of why it was there. But really what the guidance behind the 8 investments is we've got resources that focus in depth on each one, but as a collective, these 8 investments really do start to really realise the greatest benefit from physical activity is if we have this whole systems and community approach that really draws on a component and a mixture of each of the 8. So at this particular point, because I'm conscious that I've just talked through each of the 8 and there's a lot of information there, I'm going to look to the chat function and see if we've had any questions come through or any thoughts or comments. So I noticed we have one about some good examples of systems maps. There are a couple, yes, and I'm more than happy to circulate these after as well. So the systems maps, I would definitely, I can go back one. My screen's frozen again. The systems map, the ones in GAPA are a brilliant starting point, and they give a clear articulation of within each of the 4 pillars, they've mapped the system within each of those 4 areas. The Getting Australia Active is definitely a resource that I would draw on. Yes, it's mapping the Australia context, but the process and the learning associated with that are definitely relevant for everyone. And also there is a video within the Getting Australia Active website that shows how we built the systems map. Other examples, Sport England and the UK have done a lot of implementing systems maps. And there'll be many around the world, so I'm just talking about a couple of examples that come to my mind. But I guess the big thing to stress with systems maps is, and anyone on the call, if you want to share your experiences in the chat of actually doing a systems map, in my experience of doing it, it's actually the process is sometimes more useful than the visual map that you get at the end. Often we focus on what that looks like, but actually the process to understand who needs to be in the room, starting to map about who the key actors are, understanding the current needs within that particular context, and that process that you go through to have those conversations and to work all of that system out is really absolutely critical. And at times when you're trying to look at opportunities to leverage and disrupt the system, and opportunities to maybe apply a new policy or implement a new program off the back of doing that kind of systems audit, often it's that process and those conversations and the partnerships that are formed throughout that process that are often invaluable in the later stages, rather than the actual map itself. Yes, and I think you're right that there's a definite, there's also a growth in knowledge about moving from the process to the translation, and that's why there's a few England examples that come to mind, because I know Sport England have invested heavily in a couple of the cities. So we have some examples in England where we've mapped the system, they've developed a systems map, and then now they're actually implementing it within the city, and then doing an evaluation of what's happened and the result of that. In Australia, the Getting Australia Active Toolkit really was a catalyst for us having those conversations at a systems level. What does the system look like? What's the state of play? Who are the key players? And there's a great resource. And the reason for doing it as well is to really have a strong advocating strategy for a national physical activity plan. Those of us in Australia will know we're one of the few countries that doesn't have a national coordinated plan. And often articulating that in the system, what it currently looks like, is a great tool to do that. But I completely agree that the evidence base is building about how we go from the process to the translation. Any other questions or comments on any of the other 8 investments? They are quite broad. Any pitches for any new ones we should have in, or any comments about whether we've put one in that we don't feel should be there? So even if it's not a question, feel free to put any comments or thoughts in the chat as well. Okay, so I'll move on to the final section then, because I'm conscious of time. I want to make sure that we all finish for lunch on time. So A big part of developing this document was, as I kind of set up, so we've had the context, we've had the GAPA, we've had the guidelines, and the 8 investments is a clear policy guidance document to help us communicate and translate the GAPA and the guidelines into practice. It is a global document, its contributions are global, and it's a dynamic document as well. There's a whole bunch of resources, which again I'll allude to at the end, but it still is a document, right? It still is a synthesis of the evidence. And I've put this slide up now because one of the key interests of mine, and I know that ISPAH and ASPA are also committed to this, is actually developing the evidence of the how. How do we translate all of this into practice? And often the purpose of the 8 investments is to support people like you guys on the call to actually have these conversations. And often I get asked all the time, saying, okay, great, we've got this 8 investments, but what does it actually mean? What do we do with it? And so what I've put here is a diagram from Trevor Shilton's advocacy paper, which if you want to have a Google, Trevor Shilton is there's a great paper in 2016. And what he focuses on here is these are the steps of advocacy, but to get there, we've got to have a clarity of the why. So the evidence base behind the why, and the 8 investments gives us a synthesis of each of the investments and a strong rationale as to why we need to advocate for that segment. It also gives us a clarity on the what. What's the message we're advocating? Often in different countries, it's for a sub-national or a national physical activity strategy. And again, the 8 investments provide us with the message and the agenda that we can actually use as content for our messages. And this is the opportunities that we have here to advocate. And often advocacy, we focus on here. We focus on influencing ministers and politicians, and often we look up to successful advocates being the ones that we see on social media and on the news all the time. And sometimes that can be quite scary. You know, often we don't have formal training in advocacy. Many of us just kind of learn it on the fly. And sometimes we don't realise that actually within our everyday, we have an opportunity to be advocates. And what I mean by this is we can sending notes off the back of this webinar to a colleague, that's a form of advocacy. Raising awareness within the community about the benefits of activity, that's advocacy. Upskilling and training workforces and enabling our practitioners to be better equipped about having physical activity conversations, that's also advocacy, as well as academics working with media, for example, to advocate and share latest research papers. So we really can advocate and have conversations to help us increase the recognition of physical activity on multiple levels. And I encourage this because I really want to break down this barrier that that other people do the advocacy when actually we can all be advocates. So when we think about that then, well, where do we start? If we're going to be an advocate, where do we start? And these are just a couple of top tips, which is sometimes a good starting point. And it's always important, and especially as I've alluded to in the systems map, is to think about the current context and situation you're working in, and look at where are the opportunities for leaders, who are the key people of influence within your environment, who are the key people to influence, and who has a voice. Also, the context changes wherever you are. So, for example, in my state, in New South Wales, Australia, our context and environment for facilitating physical activity conversations at different levels across government and community is probably very different to even another state in Australia, let alone if we're looking at Canada or New Zealand. So really taking time to understand where you sit, who's around you, and the opportunities to build new collaborations and partners really is an essential activity. That also then starts to think about, well, what funding and resources do you have available? Is it around applying for a research grant? Is there a community grant you can look for? Has government got some funding, or is there opportunities for in-kind support? All of these conversations help you start to think, where can we put our resources, and how can we actually start to influence some changes? And also sometimes when you go through that process, you realise there's a lot going on. And actually what we don't want to do is duplicate and reinvent the wheel. And you may find some opportunities to leverage existing funding or leverage some other opportunities to maximise to get the outcomes that you'd like. There's also one of the conversations here is around organising priority groups. We often see that sometimes if we're going to have a greatest public health return, then we've seen countries put all their eggs in they're focusing on the inactivity basket. There may be opportunities within your context, a political driver or political momentum to drive on that actually focuses your conversations on a particular path. You maybe have a government that's just launched a disability strategy. There may be a government that's just launched a women in sports strategy. Whatever it might be, it's looking at what the hook and what the momentum is that you can then tag physical activity onto. And what I really hope from hearing the breadth and diversity across the 8 investments is that often physical activity comes into multiple conversations. So where you think might start off as being one conversation, and actually you think, oh, that's not related to physical activity, it actually might be an opportunity to get it in there. Often I get invited to meetings where I don't even think I'm going to have an opportunity to get it in, and then you realise, actually, that's a great opportunity to talk to someone about. We should think about, is there an opportunity to increase physical activity within this particular project? So it really is starting to understand all the opportunities to leverage. And within that, sometimes there might be some easy wins. Listening to a strategy announcement, listening to a minister's funding, all of those I always see as easy wins. They're the, can you get someone on, can you get some skin in the game, if you like? Is there some stuff that's already happening that you can then build on and start to have a little bit of traction? So if you kind of listen to this thinking, where do I start? Sometimes having a think about each of these may be a good starting point for you. What we're trying to do through ISPAH is, and with support from ASPA, is build an advocacy toolkit to give you guys some resources and tools available. These are all available on the ISPAH website, and the link is here. And we have a whole range of resources that you can draw on. So as I mentioned, we have the main infographic for the 8 investments. We then have podcasts for each of the segments. There's animations you can use, there's pictures you can download. And what I really would encourage you to do is, if you haven't already, have a read of the document, have a read of the infographic. There's also an academic paper if you want to read that instead of the infographic. And maybe send it to a colleague, send it to a friend, and set up a coffee and have a chat about it. Think about what key messages jump out for you. Distribute it to your organisation. Again, one of the big platforms of advocacy is advocating from within. Even send it to some of the key decision makers or policy makers in your area. Are you aware that this exists? Are you aware that this has been published? All opportunities for you to share the information, the resource with. And critically, if you don't feel there's anyone directly that hasn't seen it or that might be interested, then if you use the hashtag 8investments, you can tap into the global network. One of the things that we're trying to do is use the wonders of social media through Twitter and LinkedIn to actually unite people around the world around what they're doing with this. So if you've got a question, have a look on the hashtag. If you've got a comment, you can put it on there as well. That's just another platform for you to tap in and get guidance from other people doing this. We're mindful that often the resources are also in English, so we have translated the document into multiple languages that are also there. And one of the things you can do to really make sure that you tap into the resources available is to endorse the document. So this is almost like a pledge. So we've already had lots of people endorse the document on an individual or a organisational level. So I would encourage you, if you wish, to endorse the document. I'm also flagging this as well because, as I mentioned, we're really keen to build the evidence about how we translate what the 8 investments looks like in the real world in our different contexts. And in order for us to do that, we've started to consider, we're going to launch a community hub. So the 8 Investments Community Hub, which is still yet to be launched, is going to invite people that have endorsed the document or our ISPAH members to pitch and write a blog. And what these blogs over time will do is build the evidence base of case stories and real life examples of people working to implement the 8 investments. So watch this space. It's yet to be launched. It'll be launching this year at some point, and it'll be the 8 Investments Community Hub. But everything will all be on the ISPAH website. So all of the resources I've mentioned and all of the advocacy toolkit are all free and can all be accessed on the website. So then, just to sum up, I'm conscious it's been a long hour of me talking, but I've put a few of my take-home messages here. We started off looking at the guidelines and GAPA in the 18 and 2020. We really focused on the urgent need to have clear communication to target audiences around the benefits and importance of physical activity. And all of the global documents really called for supportive documents and policies that really enable us to have physical activity conversations. And through ISPAH and ASPA, one of the things we've tried to do is produce the 8 investments to be one of those such documents. And hopefully today you've had a bit of a snapshot of each of the 8. and I've given you some links to different resources for you to look at if you want more information. And really, I would just finish on everyone can be an advocate. We're all learning. There's no golden rule to do it. But what we want to ensure is that everyone is aware of the benefits and importance of being active. Being active as an individual as well is also really important. So don't be scared and thinking it's just for the politicians and the ministers. Definitely, you have a role in this, and we're excited to build the toolkit and resource over time. So I will pause it there. I'll thank ASPA for hosting this particular webinar. And if you haven't become a member, I highly encourage you all to do so. And the links for all the ASPA communities are on the bottom there. And with that, I would say thank you very much for listening. And I'm really excited to see if you've got any thoughts and comments in the chat. And I will pass back to Ash. Thank you.
Awesome. Thank you so much, Lindsay. That was such a good chat. And I think, you know, as you just emphasised at the end there, everyone has an opportunity to be an advocate in their whatever situation they may be in. And particularly, I think we can all capitalise on seizing the low-hanging fruit, you know, whether that be just promoting it in your workplace, promoting it to your family, to the people you interact with on a day-to-day basis, and also, you know, getting across our social medias and things like that to keep up to date with what's happening around, you know, the country and around the globe. So on that, we do have a question in the chat box. So Peter has said, any thoughts on how the changes emerging from COVID can be used to advocate to increase PA?
Yeah, that's an interesting one. And I think we're all in different stages of COVID management and treatment, aren't we, at this point in time? I guess I can only speak, Peter, from my experiences hearing friends and colleagues back in the UK, and also, I guess, within the Australian context. 100% it certainly is a topic that we can leverage and use to advocate for physical activity. For those of us that are in the vaccine rollout phase, seeing it as a preventative health message and seeing it as part of preventative health messaging is essential. We've seen definite evidence to show that being active, there was a recent Jim Salis paper that showed being physically active can help manage the negative effects of COVID and reduce the hospitalisation. So again, that reinforces the importance of physical activity as a health strategy at an individual level. And I guess at the minute when we're trying to embed physical activity in any conversation we have with government, we would be crazy not to use it as an opportunity to reinforce that. I do think we have to be mindful of the different contexts we're in, though. Everyone has multiple priorities, and I'm sure everyone can see the challenges it brings, but I think there's certainly opportunity to reinforce physical activity as a preventative health strategy, 100%. I also think one of the learnings we've had is that COVID has reinforced many inequalities. So the populations that have been negatively affected by COVID are the worst. I mean, everyone's been impacted by COVID, but we've seen the COVID hasn't affected populations equally. So we still need to support the vulnerable, the disadvantaged, our cultural and linguistically diverse communities, our Indigenous. We need to make sure that all of those priority populations are supported, because we know that the impact hasn't been as equal on them as well. So I think recognising all of that, we do need to capitalise on it and see it as an opportunity. But I'm also interested if anyone else has got any thoughts on that, because we certainly don't have all the answers. And I think all of us are still learning as we go. There's definitely increasing evidence from it. And I know we've published some evidence seeing the declines in physical activity during COVID. So again, it reinforces that many of us were inactive before COVID, and many people are inactive after COVID. So again, it's about recognising the benefits of moving. I think one thing that we have found, and I know within this context, is that many people have probably felt the benefit of being active. When in lockdown, one thing you were actually able to do was get out and move. So I think it's capitalising on people recognising that health and wellbeing link to being active. Probably long-winded way, but I hope I answered your question there somewhere, Peter.
I think that's a really good summary, and yeah, incredibly accurate. There is just such a disparity in how COVID has affected people's physical activity levels. There is another question down there in the chat box. If you've had a read of that one, I'll let you answer it.
Yeah, so thank you, Ron. Another great question. looking at measurements. So it's specifically collecting analysis of population data sets to inform policy and practice. I completely agree. Globally, this is a challenge. One of the outcomes of the Getting Australia Active resource, so in mapping that as a national level for Australia, for example, was recognising that even within Australia as a country, there is a lack of consistent and standardised surveillance and measurement of physical activity across our own states and territories. And there's also like a consistency over the years within those. So it was recognised there as a significant gap. And I think one of the biggest calls for any of these documents is to have national physical activity plans with a clear evaluation framework attached to it. But obviously that comes with challenges. And I think one of the outputs of GAPA was to have that clear target, and it's a voluntary target that all countries have signed up to. Each of the WHO member states have signed up to tackling an activity by 15%. So that's certainly a catalyst for having conversations within different countries about tagging onto that, because that is a government target that has certainly been out there and articulated, and that's definitely one that we need to have consistent measurement on to know whether we've achieved it or not. So probably haven't directly answered your question, but reinforce that it's a clear need. And I know there are other countries that have done that very well. We look to my New Zealand colleagues on that one. And again, I would welcome any thoughts from the rest of the group on that.
Cool. Awesome. Any other questions, comments, or anything the attendees would like to chat with Lindsay while we have her? Cool. All right. Well, we've just clocked over 12 o'clock, so I guess we'll wrap it up there. And thank you very much again, Lindsay. That was an excellent overview on a huge undertaking and a huge, I guess, topic area. And we'll look forward to seeing all of our attendees, getting across the social media hashtag and getting into this community hub when it's launched in the near future.
Amazing. Thank you, Ash, and thank you to ASPA.
Cool.